is like a gas stove, okay? And this gas is used to, so this is a stove on which there is fire and you can cook your food, okay? So this is the cylinder with the gas stove, okay? It is like the propane cylinder, okay? And over here we have a fire extinguisher. Now if you take this propane cylinder, it is like the CBD, okay? And this CBD is actually used to activate the receptors. The gas stove is like the CB1 receptors, okay? And these receptors are found in your gut as well as they are found in your brain. Are you there with me? Okay. So what happens is that this CBD is activating the CB1 receptors that is found in your stomach and it is present in your brain, okay? So what happens is that when it activates these receptors, the gut, the motility of the gut stops, as a result of which we tend to happen more nausea and vomiting because the food is not going down the stomach. So you end up having more nausea and more vomiting, okay? But with the ointment that you are using, what happens is that this CBD is actually storing in your fat cells, okay? So it keeps on accumulating over time. So when this accumulation turns up beyond the threshold, your body system kicks up and the receptors stop, and as a result of which you end up having nausea and vomiting, okay? So how you can get control of this? There are three main steps. The first is that you can take Halidol. Halidol is like the it is like the fire extinguisher which can actually blow off this fire that is used to light this whole system, okay? So when you use Halidol, it deactivates these receptors which are present in your stomach, as a result of which you will not feel nausea and vomiting. This is the first way. And the second is that you can use a hot shower. This hot shower actually resets your hypothalamus thermoregulatory system, because of which you feel that your nausea and vomiting have subsided, okay? And the third one is actually a capsaicin ointment. This capsaicin ointment you can apply on your hands and it tends to desensitize the CB1 receptors that are found in your stomach. So these are three ways by means of which you can actually control the nausea and vomiting, which is associated with the CBD receptors. But these are not the this is not the ultimate treatment, because it will keep on happening again and again as it is stimulating your fat cells, because the ointment is getting stored in your fat cells, okay? So the only way, it is like a leaky cylinder, right? So since this cylinder is leaking, it is getting accumulated in your fat cells. The only way you can stop it is by getting rid of this leaky cylinder. So only after you stop taking the CBD ointment, it will stop getting accumulated in your fat cells. It will stop stimulating your CB1 receptors in the stomach and in your brain. Only then you will have a permanent cure of this nausea and vomiting. We will treat this with haloperidol or some other drugs for some period of time, but you will end up having it again after some point of time. So is there any question for me?
Do you?
Yeah, I do.
Do you understand everything?
Yeah.
Or do you want me to repeat something I can do for you?
No, I understand, because the CBD after time it builds up.
Yes,
And
it stores
it
in your
causes-
fat cells.
Yeah.
So how many, how much you will score her in this explanation out of 10 points?
9, 10, because I understood. I got it. Yeah, I
Mm.
did understand it. I like when you do the